The most ambitious plan the Ghana Football Association has proposed to only admit persons who have taken the COVID-19 vaccines to their events. The Ghana Football Association becomes the first organized body in Ghana to implement the no vaccination, no entry policy. It means persons seeking to attend matches of the upcoming Football League season and other games will not admit persons who have not vaccinated. So what's this plan about and how will it impact our fight against COVID-19? Joining us for that conversation is Dr. John Amoisi. He's Senior Lecturer at the Global Health Department of the Kwame Nkrumah University of Science and Technology, and he's also with the KCCR. Dr. Amoisi, I'm grateful for your time this afternoon.
Welcome, Aisha. It's a pleasure to be with you. Greetings.
So what are your thoughts on the action taken by the GFA?
No, thanks for that. I think it's a highly commendable decision taken by the GFA, and I'm just going straight to the point for two reasons. One is football is essentially a contact sport, so you're going to have a lot of contact with each other in the dressing room, on the pitch. There's the involvement of the referees and people around the pitch, and then ultimately the people in the stadium. So it is a contact sport, and if anywhere there is contact or close interaction, the risk of transmission of any disease, infectious disease for that matter, is high, and COVID is definitely up on that agenda. That being said, there's only two options. Either you have a mandate to make sure everyone is vaccinated, or that there is routine testing before every match or within certain windows of matches. It is very clear that the cheaper, less invasive, less risky, and everything option is to have people vaccinated, because when you do that, you can eliminate having to test on a regular basis. So it's not only common sense, it's also definitely the right kind of public health decision. I expect this kind of decision to go beyond the GFA to very soon at health facilities and in other workplaces, in the banks. I do expect very soon we will see these kinds of mandates. I'm sure that legislators are also looking at this very closely to maybe translate into some kind of legislation, at least in the public sector, and then the private sector can also move in the same direction. So by and large, I'd say it's a great decision by the GFA.
Let's talk about
the also falls in line with similar decisions by major sporting bodies across the entire world. It's either vaccination or testing, with vaccination being the most preferred because it offers you better options and less trouble.
Let's talk about our vaccination drive, because there are a number of people who will argue that it's not fault of theirs why they've not vaccinated yet. But the WHO says many African countries are unlikely to meet their target with regards to vaccination. Ghana is one of those countries. What is Ghana's situation, Doc, if I may ask, with regards to vaccination?
Actually, you asked a great question, because perhaps that's one of the spanners in the works when we look at this decision by the GFA. The question is, we have only vaccinated barely 2% upwards of our population. And so if you have a couple of vaccines coming in, who do you prioritize? Do you prioritize our sports people over the rest of the population? Well, that's not my call. How I look at it is this way. What does the country prioritize by way of activities which we carry out? Definitely our security services are really critical, the police, immigration service, fire service, prison service, and then the health workers. These are all at the forefront when it comes to vaccination. It's been done this way. Do we want to put sports people also in the front in terms of priority? Well, that's not my call, but if we want to do that, then it would require that sports people are vaccinated so that they can engage in the sports, which also a form of entertainment and employment for many people in this country. That being said, while WHO has said that Africa is not there at all with regard to vaccination, Ghana in particular is definitely ahead of the curve in relation to several other African countries. We're by no means there, as I said, upwards of 2% and climbing upwards maybe towards 5%, but there's a lot to be done. I know there's a lot more doses of vaccines coming in to Ghana. What we need to do is to make sure that people are ready to take them. And this is where I am just a bit concerned as to whether people are ready to take the vaccines, especially now that the threat is not perceived to be as high as it was a couple of months ago. So a lot more to be done with regard to bringing in the vaccines. This, from what I understand from the authorities, is being done. We're expecting them in. The Ghanaian situation with regard to access to vaccines is definitely better than many others, but we still need to move forward quickly. My worry is also that if we don't do this quickly enough, then those of us, including yourself and myself, who were vaccinated in March and maybe took our second doses in May at the earliest, who knows, in 6 months down the line, 8 months down the line, 10 months down the line, our immunity may have waned so much that it may then put us back in a situation where we may need to consider boosters. And it's a lost opportunity, because what you want to do is to have a critical mass of people vaccinated within a time frame so that you can sort of short circuit the transmission of the virus. Of course, there's also another saving grace, which could be the number of people who have acquired natural immunity, but we don't know this very accurately. The figures are looking upwards of 40%, close to 40% within urban areas like in Accra and in Kumasi. But these are all things which we need the research and the data to inform us around the strategy towards applying the limited vaccines which we have.
You talked about how prudent this decision by the GFA is to actually curbing the spread, because the WHO has also warned that there could be a fourth wave for Africa as we get nearer to the festivities in December. Ghana certainly must be worried about this warning, correct?
Well, it's a good point you raise. Now, when you look at the data, it's very clear that the disease presents itself in waves. These waves are sort of natural, and they are also accentuated by variants. So if you look at the timing, we're just at that point where you expect there to be an increase in cases. It's already happening in parts of Europe. In Germany, cases are going up already. The same with the UK. Now, if you look in Africa, the cases are definitely on the very low side right now. But I look at the African data with a pinch of salt. The reason is the data is only as good as our testing regime. If you look at a country like Nigeria and look at their data, their curves are much, much lower than Ghana's curves, all because Ghana was doing more testing per capita than Nigeria. If you look at Kenya, you would see a similar trend like Ghana. Look at Uganda, almost flat, and then they have one huge wave, which was because they ramped up their testing very significantly during the global third wave. So if you look at the numbers, yes, there is this projected increase that we see. Should we be worried is another question. We should be worried for a couple of reasons. We have realized that the transmission of the disease and the waves do translate into deaths, but not anything around the scale we've seen in Europe. So one may say that, fine, we get these waves, but it's just a sickness. Some people die. It's not that really bad. So no need for all this, frenzied activity here and there. The argument is, if this is bigger than an individual, it's bigger than even the whole country. The way the country presents itself with regard to COVID, the way we monitor things, the deaths and all that, has an impact on our economics and the ways in which other countries will engage with us. So if we look at the bigger picture, one would say you want to make sure that we're on top with regard to our numbers, monitoring the situation. Want to make sure we are on top with regard to getting people vaccinated and showing those numbers that, look, we've achieved X percentage of our people vaccinated. And we definitely want to be on top in order to prevent deaths. It's a shame when somebody dies and you could have prevented it if you had done the right things. And we have the power to do this. So there's every reason why we should continue in our drive to limit the infections and also to ramp up the vaccination. And bear in mind that the risk of another wave is definitely there. If you look at the figures globally, we are almost at that point where things would go up, and it's better to be safe than sorry. It's much more expensive to look behind you and say, oh, had I known. It's just not worth it.
I'm extremely grateful for your time this afternoon. Dr. John Amoesi, he's Senior Lecturer, Global Health Department of the KNUST. He's also with the KCCR. I'm grateful for your time this afternoon.